Well, good afternoon, everybody. Thanks for joining us. I want to begin, as we always do, by acknowledging we're on Treaty 1 territory and the traditional homeland of the Métis. I'm joined by Jay Shaw, Assistant Chief Emergency Management. I'll have some opening comments. Jay will provide you with some additional information and updates, and then, as always, we'll be available to answer your questions afterwards. We've learned today of 5 additional COVID-related deaths in the city of Winnipeg, an additional 247 cases in the city of Winnipeg. In the last 7 weeks, we have had an additional 1,500 and, in the past 7 days, I should say, we've had 1,560 additional cases in the city of Winnipeg, 2,708 in Manitoba. Put that in context. 6 months ago, we had 290 total cases. 3 months ago, 796 total cases. And to date in Manitoba, almost 13,000, 12,909. A 5-day test positivity rate for the province of 13.7%. These are alarming numbers, and I want to just once again urge Winnipeggers to stay home. Stay home if you don't have to leave your home right now. Now is not the time to go out unless you need to, only for essentials like groceries, to pick up medications, or where you need to for work. If you are leaving your home, wash your hands, wear a mask, and watch your distance. And while you're at home, especially as we go into the holiday season, please support local. Our family will continue to support local emerging families in our city. Where you have the means, let's support our local businesses now more than ever. In terms of essential purchases, in an effort to reduce the indoor gatherings that we've seen, earlier this week I wrote to the Premier with a request that the provincial public health orders announced last week be amended to consider restricting in-store sales to essential items only. I was pleased to see the press conference yesterday with the release of those orders late last night, and I do hope those changes assist in getting the message out to the residents of our city to stay home as much as possible and only to leave for essential trips. Further to the message about essential trips, today we are asking the public to change how they use public transit and restrict their transit rides to essential trips only. Along with the public health orders to restrict all of your activity to essential, this is another way to support our community effort to reduce the spread of COVID-19 throughout our city. I understand that there is still an anti-mask rally planned in the city of Winnipeg for this weekend, and I still hope that the organizers choose to express themselves in other ways at home. Now is not the time to be engaging in reckless activity in our community. And I will once again urge the organizers of the rally, in addition to anyone that would otherwise attend, stay home. Express yourselves in ways that do not violate the provincial public health orders. I want to remind everyone that enforcement of the provincial public health orders is being led and coordinated by the provincial government. We are providing a supporting role as our city bylaw enforcement officers are being used to enforce at recreation facility closures. They are not, however, currently being utilized by the province to enforce the province's health orders at rallies. And I do hope that the province's tough language on enforcement is, if necessary, backed up with decisive enforcement action. I want to advise you that the City of Winnipeg has initiated discussions with the province of Manitoba to support their efforts in what we hope will be a rapid vaccination program, so that we are ready with a plan when the vaccine is ready. Unfortunately, the provincial public health orders have directly impacted city services and our staff. Looking forward, we do have to make some decisions regarding the staff whose jobs have been impacted by the province's public health orders. The public service is reviewing options, including options for redeployment, and that's why we've initiated dialogue with the province of Manitoba to see how our staff could possibly be of assistance to the province of Manitoba. And lastly, I want to just speak to something last night. Last evening, Winnipeg paramedics were called to the Golden Lynx Lodge. I'm pleased to hear our paramedics who attended were able to provide care to the residents, and I want to take this opportunity to thank them for their ongoing efforts, including those that were undertaken last night for the benefit of the residents of Golden Lynx Lodge. With that, I'll turn things over to Jay Shaw and be available to answer questions on these or other topics afterwards. Thank you. Merci Miigwech.
Thank you, Mr. Mayor. Good afternoon. My name is Jay Shaw. I'm the Assistant Chief of Emergency Management for the City of Winnipeg. With further restrictions now in place under the province-wide Code Red, the City of Winnipeg is asking passengers to only use Winnipeg Transit for essential trips such as grocery shopping or getting to work. Winnipeg Transit ridership is down to approximately 40% of normal volumes for this time of year. However, we know that low ridership numbers also help us to maintain space on buses for appropriate social distancing. Mask use on Winnipeg Transit is approximately 97%, but we would love to see that number be even higher. We also remind you to be kind to those who may not be able to wear a mask for medical reasons. We also reminding everyone to not take Winnipeg Transit if you are sick and to not use Winnipeg Transit if you are going for a COVID test. If you rely on Winnipeg Transit as your primary mode of transportation but require a COVID test, you can call HealthLinks and they will help you arrange transportation for you. We want everyone using Winnipeg Transit to continue being safe. As the Mayor mentioned earlier, the public health orders have also had a direct impact on city services, especially when it comes to our recreation services. With the Code Red in effect until at least December 11th, we will not be able to resume any of the fall leisure guide programming that was suspended earlier. Anyone who is registered in a leisure guide program will be issued a prorated credit on their Leisure Online account for the value of their cancelled classes. For more information, you can contact 311 through the city's website. I would also like to provide a quick update on the city's efforts on enforcement of the provincial public health orders. Since our last update on Tuesday, our bylaw staff inspected 224 locations and found non-compliance at one facility, which resulted in 2 individuals being issued tickets for not wearing masks. No tickets were handed out to the business. I will continue to remind you that you can contact 311 by phone, email, or social media to report concerns related to public health orders. I know some questions have come up regarding Winnipeg Fire Paramedic Service's response at Golden Lynx Lodge. We continue to act as part of the WRHA's rapid response team, and at their request, we attended to Golden Lynx Lodge last night and again today. Last night, 4 paramedics and a district chief of paramedic operations were at the facility between 7:19 p.m. and midnight. The crews completed full assessments of 7 residents and completed observational assessments on the rest of the residents in the facility. 1 resident was transported to hospital. This morning, the Winnipeg Fire Paramedic Service once again was asked to provide support, and we currently have a paramedic crew there on standby. We have assessed 22 residents, and as of my last update around 1 p.m., no residents have been required to transport to hospital. Finally, we need everyone to stay home. Remember to wash your hands, wear a mask, and watch your distance. We can now take your questions.
James from the Winnipeg Sun.
Good afternoon. We've been in Code Red now for a number of days. I guess it's tough to speculate, but why are the numbers not coming down?
Great question. I think probably more of a question for the province, but what I can tell you is the sort of the language that we've heard and that we're hearing out there is that it takes 2 14-day cycles of transmission to try and really get a handle on what's happening. And when you implement a fundamental change such as going to Code Red, it's going to take patience and perseverance. And that's why we're saying to everyone right now to stay home. We know it's going to be tough, but it's not going to be forever. And we're just encouraging everyone to follow those public health orders, and we're going to get through this together. Reach out, virtually to folks and take care of each other, and we'll get through this. But we're going to have to get through a little bit more time to be able to see these numbers get down.
Thank you.
Joyanne from the Free Press.
Hi, I'm wondering about the Golden Lakes Lodge. You talked a little bit about the numbers there earlier. Do you know how long WFPS might have to be there, and they're still there now, it sounds like, as well?
Yeah, they'll be there as long as the WRHA feels that we're needed to help out. Last night's call was well organized. It was a good response by the province and the Winnipeg Fire Paramedic Service. I would say that what we saw there last night was based on there were some healthcare aides that weren't able to make it into work, and we were there to support. And the province was there and staffed up as well too. They had medical folks there, and we were able to do 7 assessments and really take a look and make sure that the whole situation was stable. That's what we were asked to do. And we'll continue to support the Winnipeg Regional Health Authority and Manitoba Health at any of these facilities where we can. It's a challenge, but we're going to support where we can, and we will answer the 911 call if made.
And is WFPS stationing ambulances at other care homes to help with their outbreaks? And if so, where?
Not currently. To my knowledge, we don't have any fire paramedic service staff on standby at any other facilities right now.
Joanne, I'll just add to that. I mean, when the call is made, our Winnipeg Fire and Paramedic Service responds. The concerns that have been raised now for some time regarding just the capacity in the healthcare system and the human resources that are going to be required in personal care homes, but also the concerns about the shelters. Those concerns remain, and we've been saying now for some time that we believe the province needs help, and those concerns remain. I understand Red Cross are providing some supports, but I do hope the province is really working harder to make sure that those human resources are there, so that Winnipeg Fire and Paramedic Service ideally don't need to be called.
Sarah from CBC.
Hi, just on the Golden Lakes Lodge again. I guess, how concerning is it that paramedics were again called to deal with very sick patients related to a COVID outbreak within, within like a week or two of what we saw at the Maples personal care home? So
I believe it's concerning on a couple levels, but I'm going to sort of take this more of a macro approach. It's concerning because we're in a pandemic and we're going through some really tough times. People are losing their lives. People are sick. And so for that reason, it's concerning. The Fire Paramedic Service, we respond to the 911 calls in a professional manner, and we will get there as fast as we can if that 911 call is made. In the case last night, this was the provincial government requesting through not a 911 call, through good communication and collaboration, and it was based on the fact that they had some staffing issues there. So the concern is that this pandemic is affecting many people in many areas, and it is also affecting staffing at hospitals. It's affecting staffing right here in the city. It's affecting staffing everywhere, and these things are concerning. So we're going to answer the call, and as long as the WRHA needs us and we're able to provide those supports, we're going to continue to try and help out as best as possible.
Sarah, do you have a follow-up?
Sorry, I did, and then I kind of lost my train of thought. But I guess actually, is it sustainable to even, have to help out because there are staffing issues? Like, Winnipeg Fire Paramedic Service continue to keep doing this and kind of, yeah, that's.
I think our Chief Lane, I think, articulated very well the concerns about the issues within the Winnipeg Fire and Paramedic Service. And the paramedic service, I mean, we've been highlighting for some time concerns to the province. We're a contractor to the province. We have been trying to have some long-term stability and assurance from the province in the direction they want to go. The concern is that, you know, from what I understand happened last night, it was a much better situation than what we saw at Maple's personal care home. The nature of the collaboration from the WRHA, you know, worked from what Jay has described much better. But the concern is, of course, this isn't the only personal care home with an outbreak. This isn't the only personal care home in which those resources are stretched very, very thin. And so when the calls are made, you know, 911 service will operate as it always does. They will respond to those calls. But the problem and the challenge and the real concern is that if, you know, we have a really bad night and the queuing is significant, that's where, you know, folks, you know, safety is on the line. And so those resources in the personal care homes, in the community, to try to prevent those calls from being made in the first place is really should be everybody's priority. And we have real concerns about what we're hearing and what we're seeing in this province right now in terms of making sure that the human resources and the appropriate personnel are there to help in a time when we know those resources are being strained. And so we'll continue to advocate for those in our community who need us to advocate, and also be there to offer supports like we're doing right now, and the support that you saw being provided last night when it's needed.
Joyanne from the Free Press.
So you said this in a different way, but I think what you're answering to that question is, no, it's not sustainable. We can't be doing this every time there's an outbreak at a care home and not enough staff.
I would agree, it's not
Yeah.
sustainable, but I would also echo the comments of our provincial health leaders that have said none of this is sustainable. And if we don't, you know, stay home and start doing the right things, and we're encouraging everyone to do that, stay home, shop local, and take care of each other, none of it is sustainable. It's not sustainable for our emergency rooms and our ICUs. And if we talk about what we talked about in the spring in terms of flattening the curve, the reason why you do that is so that you don't get into these situations. So none of this, these numbers aren't sustainable. You've heard Dr. Roussin say that. So we're all working together, and we want people to stay home. That's the message. And if we do that and we all follow the orders, I'm hoping that we will see a reduction and we can start having, you know, some more stability.
You mentioned staffing a little bit earlier, and city staff, how this is going to affect them. Has there been any progress on figuring that out, or do you know at this point even, you know, which roles you're suggesting to the province folks could be redeployed into to avoid layoffs?
Yeah, the short answer is no decisions have been made, but we've initiated dialogue with the province of Manitoba because before those decisions are made, we want to see if those staff could be redeployed by the province to assist their efforts. And so we've initiated that discussion, but we'll let you know when decisions have been made. They haven't been made to date, Joyanne.
Sarah from CBC.
I'll just throw a question about enforcement out there. It could be for either the mayor or Jay. Are you satisfied with the level of enforcement that's been going on right now in the city?
I don't have the exact numbers of enforcement staff in the province that are out there with our teams. I know that there is a group that are dedicated in Winnipeg from different resources, from liquor and lotteries to conservation and the regular public health orders. We've put 9 municipal bylaw officers into the mix to be able to assist and continue collaboration almost on a daily basis with the province on enforcement. I think the message from the Manitoba government has been clear that enforcement is a factor and that they will be out there. And we're going to keep supporting that. And I hope that we don't have to enforce. But, you know, even in the last kind of 72 hours, I believe we handed out 2 tickets for individuals that weren't wearing face masks. So enforcement is still going to be needed. And when enforcement isn't needed, it's because we've got the numbers down and you know, we've got back out of code red and, you know, through orange and back to yellow and hopefully back into green. And then there's still going to need to be due diligence, and people are still going to need to be able to wash their hands and wear a mask if needed and follow the public health orders of that time. So enforcement's going to be here for a while, and we all have to do our part.
The question you've raised, you may want to ask that of the Ministers of Justice and Municipal Relations who are overseeing the coordination and the direction on enforcement, and we're playing a supporting role in a limited way with our increased now by law enforcement officers that are helping with enforcing with respect to recreation facility closures. But that's a question that overall coordination and direction is being overseen by those 2 ministers, and so you may want to follow up that question with them.
Sarah, did you have a follow-up?
No, I don't think so.
Okay, thanks. Joyanne, do you have any further questions?
I do. You said 2 face mask tickets given out. Where and when, and was this the $1,296 fine or that, I can't recall if that newer, lower fine is introduced yet?
Yeah, we won't be releasing information on the where and the who because they were handed out to individuals in terms of specific people, and I do believe they were the $298 fines.
Okay. And the when though, I'm guessing that would need to be in the portal. Do you know, have a date?
I'm just looking, sorry.
Wednesday? I think they were
Wednesday?
Since our last update on Tuesday, our bio inspected, I believe it was Tuesday, but let me see if I can get a date for you. Oh, Wednesday. Wednesday, I think it is, yes.
Okay. And then for the redeployment, I know you said still under discussion, but I'm interested in knowing what roles you think these folks could work in for the province. Because you must have some ideas to brought that forward.
Yeah, I'll let you.
Yeah, so in discussion, in collaboration with the province, but there are a lot of potential administrative roles that could be worked out. There are roles where we just have to sort of take a look at the different skill sets. Generally, municipal workforces don't have the same skill sets that you would see in a healthcare setting. There are 2 different types of governments, 2 different types of skill sets and jobs, but there are some overlap in some of those areas. So we are working collaboratively to see if we can figure out where there would be good partnerships.
Okay. And so would that be all related to COVID response, or are you talking about other things as well?
For the COVID response.
And then when you talked about transit, not using transit except for essential reasons again, are there going to be transit job and or service cuts as well?
There's nothing planned for service cuts or anything for transit right now that I know of.
Okay. I asked about redeployment already. Are there any changes the city has to make due to the latest rules on gatherings?
I don't think so. The gatherings outside, I believe, are still at 5, but we are reviewing and we go through the orders every time they're posted to make sure. But if there are any changes, we'll make sure we let you know.
And any other city closures or changes coming at all under the restrictions?
Nothing at this time.
Okay. And earlier, this one's for the mayor, earlier you mentioned that the city has reached out to support rapid vaccination efforts. How could the city do that? What help are you offering for the province for that?
Oh, yeah, no, we're not suggesting it's operationalized by the city, but we've, I mean, a couple things. We want to make sure that the planning is robust, it's comprehensive, so that when the vaccine is ready, it can be deployed throughout the community in a coordinated and quick way. It's not the seasonal flu. You know, the demand and the need for rapid deployment we know is going to be there, and so we've initiated dialogue with the province, and perhaps Jay can speak to it a little bit, but we've initiated that dialogue to see how we can play a supportive role.
So the province has already stated that they've started to work on their planning, which is fantastic. They've also reached out to the federal government to get more information. We've been talking with our counterparts just to see if there's any assistance that we may be able to provide. The message here is that a comprehensive, full-out vaccine deployment logistically is going to be challenging. The province is working on it right now, and the city's there to help if needed.
So could that be the city offering buildings where people can come get vaccinated, or staff to assist, or like how could the city help with that kind of provincial initiative?
Yeah, all of those types of things are potentials, but right now we've just had some initial early dialogue conversations, and we're very happy that the province is planning and looking for this. I think it was kind of surprising and yet kind of hopeful to see that there is potentially a vaccine coming early in 2021. That was sort of a ray of light and a good piece of news. But in order to facilitate to getting that program done, it's going to take a lot of work. We know the province is on it. We want to be there to help if they need us. And really, this is going to be a large logistical effort, and it's something that probably we haven't seen happen across Canada very often.
The reason we reached out and we've initiated the dialogue is we just want to make sure that as much advanced planning that can be occurring between governments is happening sooner than later, not when the vaccine is ready. There needs to be well thought out advanced planning given the logistics that'll be required.
Okay, and then for leisure guard programs, you said that's now officially canceled, I guess, for the season. This is the entire fall season of leisure guard programs, I imagine?
Yes, correct.
There's no exceptions. These were all rec programs that go through there that would have to be canceled?
Yeah, they're all canceled at this point, correct.
And I guess winter, or do you at this point just wait and see what happens and then decide if there'll be a winter session?
Yeah, we don't, just like yourself, Joanne, there's no crystal ball. We're in code red right now. We want to make sure that we're paying attention to the public health orders. We got our eye on the prize in terms of if and when orders are reduced and it's safe enough, then we will take a look at what programming we can do. But right now, we don't have an answer for what we're doing. Our focus is let's get out of this code red and stay home for the next few weeks and make sure that we lower these numbers.
That's something, I mean, for especially the children that have been affected, you know, the thing that we can all do is just stay home. Stay home, order in, shop local online. These are small sacrifices that could make a big difference in getting things back to you know, near normal sooner than later, so that the leisure program can get going like we all want it to get going sooner than later.
Thank you.
Are you good, Joyanne?
Yes, yeah.
All right. All right, I think that's the conclusion of our press conference then for
Okay.
today.
Have a
Thank
good
you,
weekend.
everyone.
Yeah.
Thank you.
Have a good weekend, everyone. Thanks.